Welcome to DocTalk with your host, Brent Leavitt. And DocTalk with Brent is sponsored by Battleborn Financial.
Hello, welcome to DocTalk with Brent. My name is Brent Leavitt. This is our first episode here. I am the owner of Battleborn Financial here in Pahrump, and I want to create this series to help talk about primary care doctors and accessing care here in this town. A lot of people that come here and they always ask me questions about, when they were dealing with their health insurance needs in my office, they're always asking about who do I see for a primary care doctor, who's the best in town. And I want to create this segment and really interview and get to know the doctors. My office, we're not only a certified financial planner, but I have a couple health insurance agents that work with me that help people in finding the right needs for them, whether it be through the Nevada Health Link Exchange or even through Medicare. And in fact, I have one of their affiliate doctors here, Dr. Marianne Hazlett, that we're talking to today. And those that are on Medicare Parts A and B can actually join Humana. The nice thing about Humana, their HMO, it's a zero premium plan, and it's a zero copay to see Dr. Hazlett even. Right now, she just joined their PPO as well. Humana also offers a PPO. And one little common thing during this COVID crisis, Humana is actually waiving all their copays and stuff like that, even on their PPOs during the crisis. So it's kind of unique in what they're doing. But Dr. Hazlett, tell us a little about you and your practice here in town, and love to hear more about you.
All right, well, we have remained open for the COVID-19. We've been open the entire time. We do also offer phone visits, so patients that want to call in and get taken care of and get the prescriptions refilled and anything that they need, and they can still be in the safety of their home, but at the same time, if they want to come in, talk, if we need to examine them, we are welcoming them. Anybody who's sick, of course, we want them to stay home so that, there's no spread of the virus, but at the same time, we love to see people and we want them to come in. So our doors are open and we're seeing people every day.
That's awesome. And new patients to see you, you're one of the fastest in town. Like for people that say, oh, I hate to have to call my doctor, it's like 4 to 6 weeks, but you're less than a week, right?
Yeah, for a new patient, I can definitely see a new patient within a week. We also have walk-in daily. We also have patients that we can see quickly if you're sick, if you need something. We do have cancellations, and we just fill them with the patients that need to be seen that day. So we can get in people pretty quick. I also have a nurse practitioner, Paula Wabsis, who just joined, and she can also take care of a lot of these instant need kind of appointments, and she's open almost every day to have patients come in and see her as well.
A lot of people might even know Paula. They've seen her probably before at some other practices too, right? And you're now at your practice where you are?
She's new to me, but she's been in town a short time. She just became a nurse practitioner, and she's doing great, and everyone loves her. She's very sweet.
And Dr. Hazlett, her office is actually right there off of Homestead and the 160 in that little area right there. So she's pretty easy to get to. Her practice is growing. She's able to take new patients regularly. What makes you different what's your specialty, and what makes you better or different per se than any other doctor in the area you think that might be?
Oh, well, I'm a board certified internal medicine doctor. I also do skincare. The difference is we are a private practice, so I'm not an employee of like a large corporation. So we actually have time to sit down, get to know our patients, spend time with them, and really be able to help. I also very interested in natural medicine, alternative medicine. So anyone who doesn't just want to take regular prescriptions, we can talk about diet changes, about supplements and different things they can do to improve their health so that they don't feel like they have to come in and take all of this medications. So I'm very much into alternative medicine, and that's
awesome.
Another option that they have.
And a lot of our Humana members, they really love the fact that it's a zero copay to see you. And even though a lot of their generic medications, a lot of them are zero copays and stuff on the plans, a lot of times they feel like they're just taking way too many. And even on like a lot of those, some medications are really expensive. They have those tier 3 and 4 medications, which are some of those insulins or things like that. And you help them with other alternatives too and stuff like that, right?
Absolutely. And the other really good thing about the Humana plan itself is if you have heart disease or diabetes, they have a special cardiology and diabetic plan where a lot of these medications that can cost hundreds of dollars per month are covered at a very good cost for diabetics, especially when you're talking about insulin or some of these blood thinners for cardiology. It's very important to get those medications at a price that you can afford.
That's cool. And I was going to say one thing, if you're ever interested in, as we talked about these things, if you guys ever want to make an appointment with me or my office staff about getting plans, you can call my office. We're here local, the 419-6025. And I'd love to have you guys, if make an appointment with Dr. Hazlett's office, even for like a first-time visit. As you sign up for a new plan, getting to know Dr. Hazlett. I know for a fact when I every year I always make sure I get my annual physical, get my flu shot and everything like that. And that's one thing I do is I call my primary care doctor, who just happens to be Dr. Hazlett right now, and say, hey, we need to see you for a primary visit. And they'll get you in and get your lab work done at no cost. They do a screening just to get to know your doctor. It's important to establish care. Why was it important to establish care with somebody, you think?
Especially the first visit, because you want to get as much information, know as much about the patient, their histories. Everybody is unique and they all have a different background, and having that information and really spending time with that patient, especially that first visit, to know what's going on, it makes a big difference. Because if you can only spend 5 minutes, which if I was employed, that's kind of a way a lot of these big corporations are. You get this many minutes to spend with this patient, this many minutes to make your note, and all of these different restrictions. Yeah. You don't have time to really know them or get to know what's going on. I mean, it's the relationship with your doctor is very important.
Yeah. What do you for patients that are coming from other locations, like say they moved from California, they're a refugee from California or something, how do they they're worried about their medical history and stuff like that. How do you guys handle that kind of stuff when they come over?
Usually, well, we try to get as many copies of records that we can. Also,
How do they do that? Like, is that like something you order them for the client? Do they have to order themselves? How do they get those medical records over?
It's a combination, because some doctors are great about sending over records. Others can take quite some time. What we do, if you have anything done by us, any kind of testing lab, we always give you a copy of all your results so you have your own file at home, which I think is really important, because even if you're relying, oh yeah, I signed something, you can get it from my doctor. If you have something with you, it is very easy to bring. So everybody should have a packet of their last labs, and as much as they have any imaging, anything that's really important, they should have a copy of on them. And I really strongly believe in that, and I give everybody their copies. So, but we will get them. We will get them from the hospitals. I mean, we try to get as many records as we can so that we know everything, because they can tell you the story, but we also want to see numbers, which is important, because when we're trying to look at labs, we want to know what it was before, because if everything's always been perfect, it's great, but that's not the case, and you kind of want to know what the pattern is so that we can better treat.
Yeah, so your life was always a little bit different as you go on everything like that.
Absolutely.
I want to talk a little bit, just for a few minutes. There was a big scandal with you, and I want to just clear the air a little bit about that on the paper about you. I think it's good. This is a good forum for us to talk about that a little bit, and I want you to kind of explain that a little bit and what happened.
Well, some people may have read the article in the paper. In March, I was on a cruise. I came back in the night I actually returned. I had a very high fever, and I got instantly ill. This was in the middle of when coronavirus, they hadn't really even started the quarantines or anything yet. This was very new to, with all of the restrictions, nothing had really started yet. I wanted to get tested, and I was basically told by the local hospital that if I needed to be life flown, or if I was, sick enough to be intubated, which that's kind of life or death type of thing where you're, respiratory failure, they could test me, but they didn't have enough testing at that time to do any testing. Now, I had very high fever. I was very sick. Luckily, I was able to get tested the next day, but I could, through a local lab, and I was negative. But I did have an article in the paper, because it was very frustrating when I called around Vegas. I called everywhere and I couldn't get tested, and I thought that was so important, because when you take care of all these people, and a lot of senior citizens who they said was a primary target, they have more health problems. You wouldn't want to get better and go into the office and be, and give anything or anything like this. So I quarantined myself until I had my negative result, which I was negative. And then they started the antibody testing about 3 weeks ago. My whole office, we all had our antibodies tested. None of us were positive. So we've never been, we're not immune, but we've also, never been around the virus. We've never contracted it or carried it.
So your office has been tested, been cleaned.
Oh, of course, yes.
You take great utmost care of your clients and patients, stuff like that.
Oh, definitely.
The biggest thing I like is just the fact that, working with you, with Humana, all those companies, it's great just to know that you're easy to work with. I think the biggest thing people love about you is the fact that the skincare lines are phenomenal. I know my wife even saw you for some question about some moles and stuff like that.
Right.
And also knowing the fact that you're able to look at more than just here's a pill, pop the pill and be good. It's something they love, the fact that we have the wellness center here and stuff, and really open people's eyes to there's alternatives out there. And a lot of people in Pahrump love that, and the fact that you're able to offer more than just the traditional, hey, take this, you'll be better. It's other things involved with that. Another thing, we need more board certified people out there too. And there's, I don't know, what does it mean to be board certified really? I mean, what does that?
Well,
what
it
does that
means
entail?
like for internal medicine, you basically have to sit for a second set of boards. You have to train and you have to meet an expectation in testing, and it's yearly amounts of extra work that you need to do to keep your certification, meaning that you're kind of on top of your game and that you know internal medicine and what you're doing. So,
Yeah, so you're actually certified and you're legitimate, you know. That's the biggest thing. Like, a lot of people are legitimate, but you have another board that keeps you standard.
Oh,
You know, on the
absolutely.
financial side of things, I have the financial planning board that keeps me in line too, that says, you know, every year I have to do continuing education classes and say,
Yes.
pay them lots of money, you know, and tell them, hey, this is what we're, you know, I'm actually doing my job, and if I'm not held to my standard, I can lose that certification too. And those are always good things. What are the biggest things right now, outside of coronavirus, what are some of the biggest concerns people are having medically right now and that you've been seeing a lot of?
There's always diabetes and there's always chest pain. So there's people are always afraid, is it their heart, is it something else? And that's it's a very important thing to know what kind of symptoms really can mean your heart, what kind of symptoms are more like chest pain, like you've done an injury or you have costochondritis. And I always tell my patients when they tell me that they have chest pain, think about it this way. Were you active when you had the chest pain? Did you start to sweat? Are you short of breath? Did you rest and now it went away? If you tell me, you know, you're just watching TV and you have chest pain, it's probably not your heart. But if you told me you got up, you brought groceries in, you got short of breath, you started having chest pain, you sat down, you felt better, now I'm worried about you. So you want to know, and you want to know when to get tested and what to do. And we do have a cardiologist here in town that does cardiac PET, which is a fabulous alternative to the old-fashioned stress test because it really tells you your risk of having blockages in your heart. It also tells you sudden cardiac death risk. I mean, so it's a very good test. So for someone, you know, if you're worried about your heart, that's a very important thing.
That's awesome.
And we can set you up to see him as well.
I think I want to talk more about that. We're going to go to a break in a minute, and I want to talk more about that, talking about heart health and things like that. And we'll talk about it after this break. And I think we have a few more seconds. But I mean, I think it's Dr. Eric's office, right, is who you're talking about, referring to? He's actually part of the Humana Network, too, and a part of the referral network. Not only is he here in town constantly, he's actually a part of our community as well. And
he lives, he lives in my same community.
Yeah.
So.
I think the biggest thing people love in Pahrump is those that we all live here and we're a part of the community. You see us in the store, meet you everywhere we're at, and it's great to know that we have a physician that's here, that stays here in the community. She's built the business up here, and we'll come back to that.
We will return with more Doc Talk after these messages. Welcome to Doc Talk with your host, Brent Leavitt. And Doc Talk with Brent is sponsored by Battleborn Financial.
Hi, well, welcome back to Doc Talk with Brent. I'm just a reminder, I'm here with Dr. Marianne Hazlett. My name is Brent Leavitt. I'm the owner of Battleborn Financial, health insurance brokerage and financial advisor. And Dr. Hazlett is one of our primary care doctors here in town that we're talking to today. Before we left for break, we were starting to talk a little bit about heart health and how she helps people with, you know, feeling chest pain, things like that. We're going to talk a little about diabetes, I think, a little bit too as well. But I want to talk about more heart health a little bit more again. We have a really great specialist here that's part of the Humana Network too, Dr. Tally Eric, who she does a lot of work with here that helps a lot. So Dr. Hazel, let's talk more about what we were discussing before we went to break.
Sure, absolutely. So I think one of the main things is having a cardiologist here in town is great because we don't have too many specialists, and he has top-of-the-line imaging capability here at the Healthcare Partners building. And the cardiac PET test, once again, is something that I would recommend for anyone, especially if you're having chest pain, if you have any kind of diabetes, anything that has to do with vascular-wise, you've had strokes, you have high blood pressure, just knowing your baseline is really important, because if you know there's no blockages, then you can, you know, go to bed at night and be like, okay, my heart's good. I don't have to worry about that little bit of chest pain when I lift something. But at the same time, you know, just having that peace of mind is just really important. Yeah. And if insurance covers it, then I think it's really important to get that done.
How am I going to know really if I have some heart problems? Because I know, like, I don't know much about my father's side of my bloodline or anything like that, but I know that some of my half siblings, stuff, they have a lot of some around high blood pressure problems and things like that. But when I'm younger, my blood pressure's pretty good. But how do I know really to be concerned about it? What's some signs I need to look for besides just a chest pain or something like that?
Besides chest pain, being short of breath when you're doing things. If you're short of breath when you're sitting, I mean, that could be anything. But at the same time, if you notice, every time I get up, I walk, if I have to go up a flight of stairs, I'm really kind of winded, and it gets worse over time, it's something you should have looked at, because I mean, it can of course be your lungs, but it could be your heart. Also, pain in the upper stomach, which a lot of people say, oh, that's just my acid reflux or that's my GERD. That can also be signs of heart issues. So there's a few things that you need to look at.
It's not just me being out of shape or too fat because of this COVID diet I've been on, you know?
The
Cookies,
COVID diet is
crackers.
awesome. Staying home, actually, we should be very healthy because we're all cooking at home, hopefully, and we're eating healthy, right? But it is important. So shortness of breath is another, thing that can be your heart. The epigastric pain or the upper abdomen, that's very important as well. And for women, they often get different types of symptoms. It could be the right side of the chest. It can just have just a funny feeling, something that just is off, and it's not getting better. And under stress or those types, you just really don't feel right, and you start sweating. Sweating's a big one. So if you're having chest pain or any kind of symptom and you start sweating profusely, it could be your gallbladder, but that can be your heart. And that's one of the main things in medical school. I remember a heart doctor was teaching us, and he said they could tell me all these symptoms, but as soon as they tell me that they started to sweat, that's when he got nervous. So that's a big one to consider.
It's pretty amazing to think about. I know it's like I never thought about much my heart stuff until my father just recently just started having some major heart stuff here, and it's like, well, what do we do, and how do you take care of it? And things I didn't even think about heart stuff, like even like fluid in your lungs are harder to breathe. Just like you don't realize that having heart failure actually causes fluid in the lungs. It's like, what does that happen in there?
Absolutely.
And a lot of people don't realize that, medication-wise, and they're concerned about the cost of that medication. But surprisingly enough, like if you're on Medicare and you have let's say Medicare Part A and B, and you do a Humana plan, a lot of those prescriptions, surprisingly enough, can be zero cost. So a lot of people, they don't realize that. You know what? They want you to be taking care of yourself. Insurance isn't there to be a hindrance to try to charge you a boatload of money. And Dr. Hazen's office and all them, they're there to deal with, work with you and get you in on time if you're having this kind of symptoms. And just be like, hey, let's talk to you and get to know you. And there's no penalty for seeing the doctor.
Oh, no.
I know for me, it's like I've always felt in the past, it's like, oh, I got to pay money to my doctor. I don't want to see them, It's nice to be able to, I'd rather just, I'll just die or deal with it, later on. But there's a lot of barriers out of there. Right? How do you get away from that barrier? That's the hardest thing.
Hopefully your copay is so low that you don't have that barrier, that you don't have to worry about it. I see very few insurances that are really high. There are some plans that only have deductibles, which is really hard, and we try to work with patients. And patients that don't have insurance, of course, we take them at a very low cost as well, because we want everyone to get, the best care possible.
So even cash pay people, that's pretty amazing. A lot of people are just, I would imagine somebody that comes here into town, I get some people in the interim while they're waiting for new stuff to start. They're maybe come from another plan, they're still in their old plan, and they're like, hey, I just need to establish care with a doctor, but you don't take that insurance. They can still pay cash to see you, at least get covered, care started and stuff like that.
Absolutely. If they needed to, absolutely.
It's always a big deal. You wanted to talk a little bit about diabetes too. I know it's difficult right now for a lot of people, especially to get their insulins.
Right.
Thinking about the fact that you got to take care of your body. You're cooking home, probably baking bread, because everyone wants to bake bread right now. That's probably going to make you have to insulin spike like crazy. What do you want to talk about with that, with diabetes? How can they help manage that?
Well, we also do a lot of weight loss in our clinic. We recommend the keto diet, which is lower carb, getting rid of bread, pasta, rice, sugars. That's the number one thing. The trick to diabetes, a lot of people come in, they find out they're diabetic for the first time, and most doctors are like, okay, you need to take all this medication and get your diabetes under control. Well, if they only lost 10% of their body weight, say they're 200 pounds, they lose 20 pounds, they may be able to cure their diabetes without taking any medication. So the first step is really to be very serious, work on the diet and see if you can make that change. And if you're willing to make that change, you don't need to take medicine, because initially you take oral medication, which is okay. It can even be weight friendly. But when you get into insulin, the problem with insulin is all it does is take sugar out of your bloodstream and turn it into fat. Now you're gaining weight. The more insulin you take, the heavier you get, the more insulin you need, and your diabetes just continues to get out of control. And even you're taking very large amounts of insulin now to control this, because now you have gained so much weight because of insulin. I've seen people that start on insulin at 150 pounds. Within 3 years, they're 180 pounds, and they haven't really changed their diet. But now everything they eat, all that sugar that's in their bloodstream, is now just being turned into fat. So. And
from a financial standpoint, that just gets so expensive. Just imagine
insulin is very expensive. I know. My mother's diabetic, and she's on insulin, which she doesn't like the keto diet. Sorry, Mom.
HIPAA compliant. talk about that.
But the thing is, before she got on Humana Gold, she was spending $600 a month for insulin, and people look at her and say, that's crazy, you could never be paying that. Insulin is expensive, and if you take a lot of it, it's very price prohibitive for a lot of people, and a lot of people just don't take it, and their diabetes is completely out of control.
Yeah. And there's some other things we can do, especially type 2 diabetics, just, like you said, going on diets and stuff like that. And one of the things I think a lot of people don't realize is dieting is so difficult to do. It's like, I don't want to do it. But the cool thing is your office does the weight loss stuff too, which is
right.
You help people in a controlled environment be able to control their weight and say, you know what, I can control this, not just, it's not just about, hey, I need to just change, I need to pull out the carbs and stuff like that, or I need to start exercising more. There's other things you can do to try to make it so you're successful.
Well, there's supplements that kind of help your appetite. There's injections of B12 for energy. There's something called MIC, which is all amino acids that help with metabolism. It curbs appetite as well. But even the keto diet, once you start cutting out carbs, you do lose your appetite. So you're able to stick to the diet plan a lot easier. And men, they do so well. They lose weight so quickly on the keto diet. So they come in and they are just fantastic. But I've had so many patients come in completely uncontrolled diabetes, taking no medication. They go on a diet, they lose 30 pounds, their diabetes is gone. So as long as they maintain that, then they don't have any of those risk factors of going blind or amputations. Or there's so many problems with diabetes, and heart disease, of course, is a huge one because it bothers your vessels, and you're more prone to have plaque break off and have heart attacks and strokes.
I hear like people say, well, healthcare and prompt, blah, 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 whatever it is. But I mean, we have a doctor here that can help us. We have physicians. We have, some of the greatest primary care. I want to do this show to show people we have some great resources here in this town. You don't have to drive a billion places away. Dr. Hazlett's office, this is their number, the 771-7570. You can call their office, make an appointment to see her. They're here and they're local. She's trying to grow the practice. She's not just trying to shrink things. She just hired on a new nurse practitioner even. We talked about earlier, her name is Paula, and she's phenomenal. She's been in the community for quite a while.
Yes.
And a lot of people know who she is and have already maybe established care, didn't know where she went. She's over here at Dr. Hazlett's office, FYI, and get to know them. And I mentioned Humana a lot in this because they're a big supporter of this program and her. But Dr. Hazlett does take other insurances. If you're under 65, you can work with our office. She works with all the plans through the Nevada Health Link on the exchange. And my office, Battleborn Financial, we can help people as well enroll in those plans. And she actually is one of the only doctors here in town that takes pretty much every plan through Nevada Health Link, and helping people, navigate those services. And the copays on all those plans are relatively affordable. There's plans that have copays as little as zero copays for doctors, even under 65 if you're not even on Medicare. I'm going to also notice as well, through the end of May, whenever this airs, we're going to be able to, there's a special COVID-19 special enrollment period for those on Medicare. They're allowed to make plan changes if they have not made a previous plan change. So there's an opportunity right there for anybody that's concerned about, I may be in the wrong plan, I've been having too many copays, things are tough right now. They can make some changes right now. And even outside of this time frame in June, July, August, as you keep going on, you're like, hey, I rewatched this program and really love Dr. Hazlett, I want to see her. There are special circumstances. Maybe you're suffering from diabetes, and you're like, man, these insulin prices are killing me. Or maybe I have heart conditions that are just really frustrating you. Even lung conditions like COPD and stuff like that. There's ways to get you enrolled on some of these plans to see Dr. Hazlett and get a zero copay. Maybe you already have Humana and you're like, man, I really want to see Dr. Hazlett. She's just phenomenal. I see this great, wonderful person, this doctor, I want to see her. You can change to her anytime and make her your primary care and get to see her. That's the wonderful thing about we have resources here. Are there any things that maybe I missed about healthcare and your practice that you want to discuss?
I will talk a little bit about skincare just because I do love that. I did a lot of extra training in this. We do biopsies for skin cancer. We send that in. We do skin checks in general. But I am very conservative because I know a lot of people will come to me and they say, well, I went and I had a few lesions and they ended up cutting off 6 or 7 things. And I'm very conservative. If I know it's benign, I'm not going to scar you up unless you say, I hate this and I want this off. And, of course, we'll take it off for you. But I'm very conservative. It's very obvious what is a skin cancer, what isn't. There's benign lesions and they have certain characteristics. So I'm very conservative. I won't scar you up like I've seen. I've seen people come in with giant scars. I'm like, what did you have? And they said, oh no, it was nothing. It was benign. But we're very conservative. So
And you're not you understand what it is. To get
and we
those
can
done.
look at it and tell you what it is.
And a lot of people are worried about, I know we always should talk about, but cost and stuff in those procedures. I know a lot of that's not usually covered in your traditional office copay a lot of times, but you might find that maybe under deductible, stuff like that. Is that the case with you, or how does that work with it?
Well, under Humana Gold, I'm a provider that can do the skin procedure, so there's zero copays, there's no cost at all. It's just a regular office visit with me, so that's very good. But there's no additional charge usually for most insurances. Sometimes it hits deductibles, but we try to adjust and work with patients the best we can when it comes to those types of prices if there's an issue like that.
Yeah, that's pretty amazing. I mean, just to be able to know that, hey, you can get something, especially skincare lines of skincare. I know, like,
Medicaid covers everything, so that's not a problem either.
Yeah,
So
Medicaid
that's great here
and
in
we have
this
a lot of
county.
people. Yeah,
we're
we got a lot of
very
people.
lucky.
We have a lot of people that are on Medicaid, and I'm not to be like ashamed about that. I mean, oh, sorry, we got to keep going. Okay, the Medicaid stuff like that is the fact that she does take it. She's a provider for it, and you have choices of physicians, and Dr. Hazlett's office is available to us. Thanks so much for tuning in, everybody, to Doc Talk with Brent. Hopefully join us next week at the same time, same place. We'll post on Facebook as well, and look for us, Battleborn Financial and Dr. Marianne Hazlett. Thank you.